This is Joyce Graff. I'm with The Powerful Patient, and we're here today with Dr. Daniel Monti, and he's going to tell us about his new book, The Tapestry of Health. So good morning, Dr. Monti.
Good morning. Pleasure to be here today.
Thank you. So, Dr. Monti, this is Megan Conley. She's a volunteer.
Hi, nice to meet you.
And, she's very interested in this topic too, so I asked her to join us. So tell us what inspired you to write this book.
So our book, Tapestry of Health, really came after years of building an integrative medicine program, then institute, and now department at Thomas Jefferson University. And as of about a year and a half ago, we became the first department of integrative medicine and nutritional sciences in a medical school in the country, maybe the world. And this, for me, was important because for the last couple of decades, I've been really pushing for the medical community to consider, look at, and even embrace some of the concepts of holism, wellness-oriented strategies, things that can make a real difference in illness management and disease outcomes. And you know, that long road had lots of twists and turns. Some of it was doing clinical trials, and we've done many of them in our group. Some of it was informing people through educational programs. And then finally the leadership said, hey, there's something here. And I think that's starting to happen around the country. And thanks in a large part to people like you who've been pushing this agenda for decades, and now people are finally starting to listen. So thank you for all that you do.
Oh, thank you. You know, it's very interesting. I think my first experience with what now I would recognize as integrated medicine, it was Lamaze classes before my son was born. He was born in 1971. And so I took my Lamaze classes, and I find myself using Lamaze breathing at the dentist, or when I'm getting a shot, or anytime that I'm under stress, that tool comes out, and it's been extraordinarily useful. So that was my first thing.
Actually, I love hearing that because I actually never thought about it with Lamaze until you said it. But of course, yes. And breathing is so important. I mean, there's so many things that are so important, but one of the things we talk about in the book is that when we're working with patients, we evaluate their stress levels because stress has a negative impact on every disease. And how that disease goes is going to be worse if there's more stress. And we have to have ways of navigating stress because there's always going to be some of it. As the late, great Lena Horne said, it's not the load, but the way you carry it. And so what are those tools to help you carry that load? And breathing, it sounds so simple, but most people don't breathe because we get into that fight or flight mode to sort of take on the day. And when you pay attention to your breathing, you notice you're taking short halting breaths, you're holding your breath. And when you actually just take the time every day to just breathe for a few minutes, you reset the nervous system, which has huge positive consequences.
Right, and then Dr. Herbert Benson from Boston did some seminal work in a series of books. He was a cardiologist, and he was trying to help his patients control their blood pressure without medication. And so he studied the yogi traditions and so forth. And that's when transcendental meditation and other things like that began to become popular, and people began to realize that there's more to this. It's not just a flaky, silly thing that people are doing, that it really has therapeutic effect.
Exactly. And right along those lines, when you talk about meditation or meditation programs, so in the book, in the center, we have some glossy photos. One of the things that we're good at on our research team is brain imaging and looking at how some of these interventions that we do, whether they be stress reduction related or nutritional, actually change the brain and how the brain functions. So now with the ability to do functional neuroimaging, we can see things and characterize things and even quantify things in a way that never was possible before. And so we have a couple of pre-post brain scans of people who were distressed and went through some of our stress reduction programs, whether they were meditation-based or sometimes more focused if somebody had a very traumatic event like PTSD. And it's just amazing how the brain accommodates to stress and distressing events, and then how it changes when you actually find ways of alleviating it. And those changes are huge because everything then kind of goes down. So if the brain is activated in a way that isn't so good for us, we'll call it a negative way, that has consequences throughout the entire body, from how the nerves intersect with organs to also how chemicals are released that affect the immune system and the cells of the immune system.
Right, because doesn't it have hormonal effects? It
Absolutely.
changes your body chemistry.
Yes, one of my old friends who passed away a few years ago, her name was Candace Pert. She was a well-known author, but more than that, she was a very esteemed researcher at the National Institutes of Health, and actually one of the first women in her time to become famous, because there was, a lot of barriers in place for women back when she was sort of in the 60s and 70s trying to sort of make her way. And she did something brilliant. She discovered what essentially is the morphine receptor in the brain. And she said, hey, listen, if morphine creates this effect, then that means there must be some receiver in the brain for this chemical. And then that led to all the work that she and others did on endorphins, because those are our natural sort of, we'll call them opiate-like substances in the body. And then some of the things that we talk about in the book is, okay, since that chemistry exists, what are the things that we all can be doing to feel better, to sort of increase those positive biochemical pathways that make us feel better, and decrease the ones that hurt us, such as inflammation?
Yeah, it's interesting. I have a friend who's a runner, and I sometimes said, why do you put yourself through all this? I can't imagine myself getting up and going for a 5-mile run. And he said, I do it for the drugs, because, it releases endorphins and makes you feel.
That's right. That's right. That's one of those. That's one of those addictions that has a positive effect. There aren't too many.
Yeah. So, Megan, tell us your own experience with integrated medicine.
Well, actually, talking about stress, my husband and I have been trying to get pregnant over the past few years, and I had an ectopic pregnancy, and then was subsequently diagnosed with fibroids and endometriosis and PCOS. And one of my more recent conversations with my my OBGYN was stress. And she said, sometimes your body, if you have so much stress, your body will not allow itself to get pregnant. And I never really thought about that. I knew that stress could impact your health, but so I'm trying to be very cognizant of my stress levels, and trying to do, things like meditation and exercise and yoga, and even, not drinking caffeine or alcohol, just kind of watching my diet, drinking a lot of water, making sure I'm getting enough sleep, just, trying to stay ahead of the stress.
You're reviewing many of the chapters of the book right now. And you have a good doctor, because there is clear evidence that, and the good fertility experts, they know to address this component of life. Because listen, our nervous system governs everything. And if the nervous system is too out of whack for whatever reason, but if stress is the reason, then that's one of the ones that we can get control of in some way. And when you think about it, for those, who are listening, who maybe have, taken a biology class and have heard about the autonomic nervous system, the sympathetic versus the parasympathetic, I'll make it simpler. The one kind of mode of the nervous system is fight or flight, to keep us alive. And the other one is restoration and recuperation, like when we're relaxing, sleeping, when we sleep restfully, and those kinds of things. Now, we need fight or flight because sometimes there's a real threat in the environment, and we need to mobilize and keep ourselves alive. And then the nervous system is supposed to reset itself and go into that restoration or recuperation. But imagine this. So this hardwiring has been around for a long, long time. So think about, days of yesterday, and for some people still today, you're out in the jungle and you see a lion in the distance. You want your nervous system to activate without you even thinking about it, because it's like, fight or flight mode. Now, if you're smart, you'll choose flight over fight, probably. Climb up a tree, and the lion passes by, looks safe, the nervous system resets itself. The problem with today is that reset never occurs. That reset just can't happen. We're in a pandemic. There's uncertainty. Uncertainty triggers that fight or flight mechanism. People have uncertainty about work. Are your kids going to go to school this week, or are they not going to be going to school? Then do you have to homeschool? How do you juggle that with work? What about your aging parent or grandparent or aunt, and how are you keeping them safe? And all of these things just build and build and build. And so we have to have ways of intervening with that fight or flight response we're in, because what happens when you're in fight or flight? Again, survivalistic for the short run, but long term, the body, the nervous system sends the signal to the musculature and everything to pool the blood there so you can run, fight, and away from, say, the digestive tract. So people who are stressed always complain of GI complaints. I can't digest my food, I have bloating, I have this, I have that, because that makes sense. A distressed body is in fight or flight mode. That's not a time to be thinking about food. And also they're hypervigilant, they're anxious, or their brain is too on, because they're looking to sort of solve whatever these issues are going on so they don't sleep restfully. It's all the more reason, and there's so many other of these things, because all of the different organ systems are affected, and over time immune health is affected. We need immune health to be as strong as possible during this time. We need resiliency. And so in a way, addressing stress and the things that stress you out. Now, there's certain things that you can control and certain things that you can't. One of the things that you can do is learn techniques, take a meditation class, or even Lamaze, I guess, even if you're not pregnant, learn to breathe. And because the breathing really helps, as do mindfulness-based stress reduction programs and many others. And if there's a specific issue, then there's individualized approaches that can, make a big difference. And maybe it's some behavioral things that keep you going. Because, like, for example, I know, and maybe you know some of these people, and some of you might be listening, and I was a little guilty of it at first at the beginning of the pandemic. We become sort of news junkies. So a lot of people are sort of spending too much time watching like cable network news, and there's a reason for that. The brain feels the uncertainty, and one of the things the brain likes to do is fill in the gap so that there is more certainty and you feel more safe. The problem is the news of the day can be summarized in about 5 minutes, the actual news. Then the rest is just talk about the news. But what good news stations do, because that's how they make their money, is lure you into thinking there's more answers in the next hour and then the next hour, but there really isn't. The news is kind of the news. And so getting people to break that pattern is just one example. Another that you really honed in on is what we eat. Because there are foods that actually add to the stress burden of the body, and there are those that actually give the body vitality and the nutrients it needs to really be resilient and strong. And so I try not to overly focus on the bad ones. A lot of, we kind of know what they are, but we need to be thinking, how do I get more living energy in my body? How do I get more plants? Is there a way I can make a smoothie every day? Is there a way I can nourish and nurture myself? Because if we don't do it, nobody else will. And you don't want to wait until there's symptoms. But even if you're listening, and I've seen a lot of things get better and reverse themselves, or the course is a lot better by, one, breaking the stress that we're talking about, but two, intervening with nutrition and a nutrient-based approach to things. And the other thing you mentioned, since I love how you summarized some of the most important things, is sleep hygiene. We, in a time like this, people, I'm working from home so I can go to bed whenever I want to, and all those kinds of things. It throws off the biorhythms. And if the biorhythms are off, that's stressful to the body. It adds to the inflammation in the body. So we talk about strategies of how do you get your sleep hygiene back in check? How do you get your diet back in check? How do you address some things with stress? And how do you kind of deal with the fact that you need to be active? The body likes to be active, but there's restrictions to that right now. So these are some of the big categories that we talk about.
Megan, have you tried acupuncture at all?
So it's interesting you asked. I actually tried acupuncture last month for the first time. And, I laid on the table for, it was 30 minutes, maybe closer to an hour. And she placed needles in certain pressure points. Obviously I went there for fertility issues. And I left feeling relaxed, but I left where I wanted to believe that it was doing something or that it would do something, but I wasn't quite sure if it was. I left feeling relaxed just because I could I laid under a heated lamp for 30 minutes and it was quiet, and or if it actually did something. So I haven't gone back, and I've debated. I mean, what are your thoughts on acupuncture, Dr.
I know a number of women who have gotten pregnant in their 30s after de-stressing, and one of the key ingredients was in fact acupuncture. And one of the things they described to me is that they felt like their whole innards had relaxed in a way that they hadn't felt in a long time, because we do, as you described, carry so much tension all the time that we're not even conscious of, because I find myself watching more news than I've ever watched in my entire life. We're at a sort of tense time in the country, and so I'm kind of on alert, as it were, almost all the time.
There's some interesting data about acupuncture. There have been some limited studies about acupuncture and fertility. And I think that we often recommend that women give it a try that are in your situation. And some, as you mentioned, Joyce, it helps, or their perception is that it helps. And it's one of those things that it's not going to hurt. I give it a few sessions. I think that, I'm a little bit biased for it because I had a positive experience with acupuncture back when I was in medical school. I had a couple of those positive experiences, one with nutrition, one with acupuncture, and I was like, oh, these things matter. What I eat matters. And I was always struck by, in traditional medical education, how little of that was covered. How little of it, even nutrition. So acupuncture, we can say it's a different system of health, but nutrition, we had like a week of nutritional deficiencies. You have so little vitamin C that you have scurvy, or so little vitamin D that you have rickets. But what about a healthy amount of vitamin D? And what does that do? What does that do to your immune health? Like, for example, we're entering the cold and flu season. We know you need enough vitamin D for respiratory function, and that people who have respiratory illnesses tend to do worse when they look at the overall data in some of these studies if their vitamin D levels are very low. So, of course we need our basic building blocks and nutrients. And I don't know how that got so disconnected from medicine, but the good news is it's kind of reconnecting. One of the things, if I could take that tangent for a second, is that, there's the difference between sort of making sure you have enough of those right building blocks by having a healthful diet, and it's something that I talk about in the book, but also using higher amounts as a pharmaceutical in a clinical trial. And we actually have a clinical trial going on at Jefferson that I'm doing with somebody in our infectious diseases department for people who are admitted to the hospital with COVID. And we're giving them an actual infusion of vitamin C because we think that it's going to activate the immune system. And we're comparing that to people who just get standard care. Both get the standard care, they get the remdesivir, they get everything. But our group also gets the infusion of the vitamin C. And we're very hopeful because, again, this is integrative medicine. How do we integrate the use of natural molecules and holistic-based principles and wellness-oriented strategies to add value to the medical treatment plan? That's what this is really about. And so we're often looking at those things. And, as I mentioned earlier, in the center of the book, there are these glossy photos. There's this nutrient that we used that, we used it in a higher amount than maybe you would take over the counter. It's called N-acetylcysteine, but it is available. And we saw a change in Parkinson's patients. And we're now doing a follow-up study to that. So I think in the overall model of what we talk about in the book, we're trying to sort of push the bounds, not just of wellness, but also medical interventions using natural therapies.
One of the things that strikes me about your description is that I think it began happening in the 20th century, that we had this arrogance of things that we invent, things that science now understands, that we can do it better. Better living through chemistry was one of the bywords of the 50s. And similarly, we thought all this new stuff, and therefore we need to reject all the ancient things, all that old village medicine, the woo-woo, the witch doctor kind of things. And there became this separation between the glory of the new science and the trashy old stuff. And I think little by little, we've learned over the last 50 years that there's a lot of good stuff there. Human beings really haven't changed their engineering a whole lot for the last couple thousand years. And the observations of the ancients actually have value for us today. And so I see integrative medicine as bringing together that witch doctor stuff, if you will, or the ancients who said, let food be your medicine and medicine be your food. All those traditions and the transcendental meditation and acupuncture that have been around for thousands of years, and we're suddenly saying, oh, they weren't so stupid after all.
Absolutely, it's beautifully stated. And one of the things that I try to do and my team tries to do is add the science to support that wasn't so stupid after all, that it wasn't just a witch doctor, that actually there's real data to support that. We have real brain scans, we have immune markers and immune outcomes and disease variables that change over time when you do some of these things. And I think that's what was needed to sort of push the pendulum back, because you're so right. The pendulum way overswung. In the early 1900s, there was something called the Flexner Report that came out and just created the standards of what should be in medical school didactics and their education. And it just pushed out anything that wasn't in this sort of reductionistic science. I sometimes, like to say that I chose the metaphor of tapestry for the book, Tapestry of Health, because, in a way I'm being anti-Descartes. So, Descartes, who, kind of had a relationship with the church, who wanted to sort of own thinking and the mind and soul and all of those things, said, mind and body are completely different. They're different substances. The body is matter, the mind is thinking, they have nothing to do with each other, so it was this mind-body disconnect. But actually, the complete opposite is true. And so, I loved this metaphor of tapestry when I thought about it, because a tapestry, you can see the picture from the front or the back of it if it's a true tapestry. And it reminded me of how body and mind are the flip side of the same coin. And when we bring it then to modern science, the things that affect the way genes express themselves, like how, a given gene will express itself to go in one direction or another, there's a lot of things that can affect that. Things that are not in our control, like if a poison can actually affect gene expression in a negative direction. Exposures to other things. A drug can affect gene expression, but actually, nutrients or lack of proper nutrients affect gene expression. Stress affects gene expression in one direction or the other. So we have genetic expression and then things we can measure like functional neuroimaging. All of that brings back the science and, hey, mind and body aren't separate, they're the same. And we now have a scientific basis to talk about that. And so that's why, in the book, what I tried to do is the balance between it not being too boring with the science, but providing that scientific basis and rationale and showing people like, look, here's the data, so that they felt like it wasn't so vague or woo-woo to then do X, Y, or Z, eat this way, sleep this way, address your stress this way.
Right, and it doesn't have to be a revolution in your life either. I mean, one of the easy things that I usually say to people is start with just plain breathing. I mean, we all do it all the time. You can do it when you're sitting in a chair. You can do it when you're watching TV. I mean, you don't have to have any special equipment. Just focus on your breath. And I remember some of the phrases from the Lamaze breathing. It said, your body knows what to do. You need to get your mind out of the way of your body. So take your brain to the beach. Create this image in your mind where you have some place where you feel relaxed, and just breathe and think about take your mind to the beach. And it's so simple. Anybody can do it. And when my son was 15 and needed to have surgery, I actually took him to what has become the Mind Body Institute in Boston. Yep. And had him do breathing exercises, because I had read from Dr. Benson's research that people who understand how to control their body stress need less medication for pain after surgery, and they actually heal faster. So just simple little things like that you can do right now. And I think that those are tools that we need to reactivate in all of us.
You keep bringing up the most perfect points, because I think that sometimes people get all or nothing in their thinking. I have to, if there's this healthier way, I must do it all.
Yeah.
I tell people, like, when they pick up the book, they're like, okay, I'll start at chapter 1 and just start doing everything. I'm like, you know what? Read through the table of contents. Maybe for you, the thing that jumps out is you're really struggling with sleep. Read that chapter first. And, we're not linear creatures. We're never perfect at all times. You may not be the Mother Teresa of nutrition every second of the day, but you start somewhere and you just build upon it, because everything you do actually does make a difference. So it's not all or nothing. It's not like, I cheated on my diet, so it's all lost. It's not all lost. You built up some resilience up until that moment where you quote unquote cheated. We don't even have to look at it that way. Now go back and keep building up more resilience. And I really just love that, because, sometimes people say, I don't have time to meditate for an hour today. Okay, then breathe for 2 minutes and do that to reset the nervous system. That all or nothing thinking is really important, I think, when it has to do with our lifestyles and what we need to be doing to sort of nurture and nourish ourselves. Because remember, we're all juggling all these balls in the air right now. There's just so much going on, right?
Right.
The reality is, most of those balls are rubber. If you drop them, they'll bounce back.
Right. Megan, what comes up for you as we're talking?
Well, as we're kind of talking about, different ways that people can help with whatever issue they're having. I was thinking about some of the documentaries that have been out on Netflix and Amazon Prime, and they talk about people that have, different medical issues. Maybe it's eczema, and how just a change in their diet has been able to treat their skin condition. And so just kind of wondering, are doctors too quick to prescribe medications, and are patients too quick to just accept them? And, as a practice of medicine, should doctors be looking more towards these holistic, approaches?
Yeah, the answer is yes all around. So what we have is, a situation where the medical system has become rather passive for the consumer. So you go and have medicine done to you versus you're a proactive part of your health and wellness. And we see the effect of this in terms of our health status as a nation compared to other industrialized countries of the world. So for example, the World Health Organization puts our health status as a nation. Here we are, the richest country in the world, Do we make the top 10 list for healthy lives and healthy life expectancy? No. The top 20 list? No. The WHO puts us at about 37th. And then if you look at, if you look at longevity, just how long do we live? We don't live as long as many other countries who don't have our resources. And then if you look at a subcategory called healthy life expectancy, which means living, long, but living without significant disease burden and morbidities, we don't make the top 10 list. There's some European countries that do, some Asian countries do, for women or men, because they look at men and women separately. So what's the disconnect? Is it that we don't have good medicine in the United States? We arguably have the best medicine. People come from all around the world to learn our medical technologies. We have access to the best pharmaceuticals. So it's clear that medicine does not equal health. Medicine is really to put out fires. And so when you talk about your primary care physician, like, these are good people, and they're trying to help people. And, I've got, many colleagues that I love and admire in those areas. And it's a low reward job, but they're running from room to room. They have 5 to 7 minute appointments, because that's how the insurance system has set that up. So it's like, all right, that person's diabetes is out of control. Here's your prescription. That person has a raging, sore throat. Here's your prescription for an antibiotic. Do I need to send this person to the hospital? I need to make that decision. And it's sort of like putting out fires, putting out fires, putting out fires. But the issue is, what do we do when, we're not in an acute fire to sort of prevent the next fire? What do we do to create resilience so that we're not in that situation, or we are less so, or whatever illness we might be unfortunate to have, we weather the storm better? Do most physicians agree that there are things people could be doing? They do, but they don't have the infrastructure in their practices. They don't have the time. And actually, the medical school curriculum doesn't provide much about that. That's why we're excited about our department. That's why we're excited to begin teaching programs, CME events, certification programs at Jefferson, where I work, and others are following around the country. So you're going to start to see kind of a slow change. Paradigms change slowly. There's a great chemist, for those of you listening who maybe took chemistry. Rutherford was his name, and he gave the graduation speech for graduating doctorates of chemistry, and said, listen, when you have a great discovery, a really innovative thought, don't come back here. Don't try to convince your old professors about it. That's not where that change is going to occur. So, we have a little bit of the old guard that holds on strong to the old paradigm. But what I see that's really encouraging is this whole generation of young doctors that are thirsty to know more about mind-body practices, more about nutrition. I mean, we are just filling up our programs with doctors and students who are like, I want to know more about this. So it's changing.
Thank you. And, one of the things along the lines of what you were just saying, what I've come to understand is that the U.S. has the very best in the world fix-it medicine. We know how to repair things. We know how to operate. We have all these fancy tools and knowledge and so forth. What we don't have is health maintenance medicine. And when I started looking at, because I've been working with rare diseases for 50 years and working with people all over the world who have this rare disease, because rare diseases don't know national boundaries, right? So I started out working in the US, and then the UK and Denmark, and little by little, many of the countries of the world. And what I realized is that in countries that have healthcare for all, they've made a commitment to keep us healthy in the workforce and paying taxes for our whole lives. And they have a vested interest in keeping us healthy. And so they make more prescriptions like eat better and less red meat, and work with the grocery stores to have better and fresher vegetables. When I walk into a grocery store in Holland, for example, what strikes me is the colors. The colors are so much more vivid in a grocery store in Holland than you ever see in the United States. It's just striking. So it's all of the above. And we can supplement, even while our healthcare system is learning the lessons that you all are teaching in Philadelphia, we as individuals can try to supplement what's available to us by paying attention to all these other dimensions of health maintenance.
Again, really beautifully stated. That really is the issue. And I think that, one of the things that many of us are struggling with is that for whatever reason, these basic principles that are scientifically based about health and improving health and health maintenance have become like politically contentious in some way. And so I feel like if we all can just step aside from that, because I'm not running for office, and neither are probably most people who are on the podcast listening or whatever. Put aside all of that and let's just go with what makes sense from a scientific perspective, from a perspective of what have we learned over the centuries in terms of well-being and wellness. I think that if we get into that consciousness and think about, all right, I'm going to be more proactive in terms of my health and wellness, even if we currently have a system that's a little bit paternalistic. It's a little bit of medicine is done to me versus I'm actually an active participant of my health and wellness.
Thank you very much. And that's what we're all about at The Powerful Patient, is empowering people to be active participants in their healthcare. Megan, you have any other questions for us before we start winding down?
Oh, well, I mean, I feel like our conversation could just go on for hours. This is really
interesting.
Happy to come back.
Thank you so much. This has been wonderful, and we're delighted to hear that integrative medicine is becoming more of the done thing in medical schools. And I hope that your pioneering work will move it forward even more. You stand on the shoulders of some pretty great role models there: Herbert Benson, John Kabat-Zinn, so many good people. And it sounds like you're taking us into a new dimension with it. That's very good.
That's, there are just so many great people who've made a huge contribution, and people out there like you who are just putting the message out there really makes a huge difference too. One thing I'll just mention before we close is that we sometimes have, an informational session. And if people want to go to the website for the book, tapestryofhealth.net, we are going to have sort of a whole Q&A on these kinds of things, a live Q&A session on October 20th. So that if you were thinking about things watching and said, I'd like to ask him this, or the amazing person I wrote the book with, who's an expert in hormonal health and some of those other things, we're happy to be there and be available for you.
Wonderful. Thank you very much. So we're recommending that you go to tapestryofhealth.net and look for his event on October 20th. And I'm sure lots of other good information will find its way to that website as well. So thank you very much. And Megan.
Thank you, Dr. Monti. This is great.
Megan, Joyce, thank you so much. This was really a pleasure. What a great conversation. Thank you.
Thank you. And thanks to all our listeners for being with us. We hope that you'll watch for more good shows at powerfulpatient.org. Thank you.